Uterine fibroid tumors are often treated with a hysterectomy, but there have been many advances in the field that allow for successful treatment without major surgery. Here with more information on some less invasive ways to treat fibroid tumors is OBGYN and ABC News medical contributor, Dr. Jacques Mertz. Dr. Mertz, great to see you again.
Good to be back.
Thanks for being here. Now let's talk a little bit about fibroid tumors. What are they exactly?
Fibroid tumors are muscular tumors. Now, tumors and cancer are different. Tumors means a growth. So they're a growth of kind of smooth muscle tissue. Very, very common. About 77% of women will be found to have fibroids. Now that doesn't mean that they have to do anything about it. And about 20% are going to end up having problems with the fibroids.
And when you say problems with the fibroids, what are they? Are they painful? Is it more than that?
Well, the first thing is bleeding. Heavy, heavy, heavy bleeding. If you have really heavy periods and you're passing clots, you need to see your doctor because there's a really good chance that you have fibroids and you may need some kind of therapy for it. The other one is they can get to be huge. They can get to be about the size of a full-term fetus.
Really?
And obviously that can cause pressure, that can cause pain. So those are the two major ones, bleeding and pain.
So, but other than that, if your fibroids are small, they may be manageable.
The majority are going to be found at routine exam, and now with sonograms, even before routine exam, do not freak out. The first treatment for fibroids is no treatment, is just to watch them. If they're not bothering you, don't bother them. That's what I tell my patients. And let's just follow them throughout the years.
And are there certain women who are more susceptible to fibroids than others?
That's a great question. Women of color, twice as much as Caucasian women. Asian women, increased risk also.
Is there an age range in which they begin to appear?
Well, they can start beginning to be found in the late 20s, and they get to be really problematic usually in the 40s and just before menopause. And that's the thing that's so frustrating about them is they tend to grow just before they would shrink away.
And so when they become problematic, the treatment has traditionally been a hysterectomy. Is that right?
The cure for fibroids is a hysterectomy. And a hysterectomy comes in many different variations and varieties. Women always think that if they have a hysterectomy, they're going to go into menopause. That's not necessarily the case. There is the kind where you remove the ovaries, and yes, that happens.
Give us a refresher on what exactly a hysterectomy is.
So hysterectomy is just taking out the womb. Now, other than taking out the womb, the ovaries are right there, so many doctors will say take out the ovaries to decrease the risk of cancer. That's becoming a thing of the past. It can be done with an incision, and now it can be done laparoscopically. No more periods and no more children afterwards. So you have to make sure that you're done childbearing. And
a hysterectomy is obviously major surgery. So aside from the obvious that you can no longer have children, you'll be undergoing a major surgical procedure.
All procedures are major, but definitely hysterectomy, and there's 600,000 done in America every year. The majority for fibroids is a major operation. And
so now there are some alternatives.
There is some good news.
Tell us a little bit about what you think is the most promising.
Well, there are two. One that's been around a little while, so we can say now that it's tested, and a new article just came out showing that it's very effective, which is called uterine artery embolization, UAE. And basically what happens is they make a small incision in the groin, and a radiologist goes up to the fibroids and blocks them, puts some little tiny pellets in it, and cuts off the blood supply.
So that prevents it from ever growing further?
It's interesting. We don't know exactly how it works, but we do know that for bleeding, that procedure is highly effective. It kind of shocks the fibroids and makes them shrink a little bit.
Okay, so at least it prevents the bleeding.
It does work very well for bleeding.
And now there is also a method using sound and ultrasound?
Right. Really cool method which basically uses sound waves, just like the sound waves that are used when you're pregnant to look at the baby, but more focused, because it's called focused ultrasound, and it sends out sound waves that release heat and can cook the fibroids. FDA approved, I don't want to say experimental, but hasn't been out as long as the uterine artery embolization. Insurance does not pay for it, and it is a long, long procedure that only works for certain kind of fibroids and in certain patients. But I think it's the future.
So, and it would require multiple visits?
It may. The first visit, they try to do it all at one setting, and basically you have to lie flat on a MRI machine, and the sonogram comes underneath and sends out these sound waves. It can take about 5 hours, believe it or not.
Who would be great candidates for these alternate procedures? Obviously women of childbearing years?
Well, that's the problem with childbearing year, because they don't have enough information on these pellets. Do these pellets go up to the ovary? Can it prevent having children? So right now, Most of these new procedures are limited to women that have finished having children. They're not
okay.
experimental, but just for us in medicine, 10 years, 15 years is when we get comfortable with something. And we're just
Right.
not there yet on these.
So what percentage of women who are suffering from extreme fibroids are women in their childbearing years, more or less?
Well, of those that have symptomatic fibroids, probably about 25% are in the childbearing years. And now that you need a different kind of operation. You want to just go in, it's called a myomectomy, go in, take the fibroid out, close everything up very gently and leave it there so you can get pregnant.
Oh, so that allows. Oh, so then
Right.
why not use that procedure on everyone?
That's a good question. That's a trickier procedure. It's associated with more blood loss, and we usually use that one on women that want to have children.
I see. Okay. And women who are past their childbearing
Right.
years, that's not an issue.
That's more likely either the uterine artery embolization or a hysterectomy.
All right, Dr. Jacques, thank you so
Great.
much for bringing us up to speed on all the new developments. And remember, you can check with your doctor always for more information. And for the latest health news, be sure to visit the health page at abcnews.com.